But believe me, the happiness will come when you will treat a very bad patient. বুঝতে পেরেছিস? In the college life, I was in the GS, AGS, all the posts I have handled. That was an era. But believe me, after completing MBBS, then internship, then little bit RMOC in some private hospitals like Apollo, I was there in the 1 year under Dr. Nayan Banerjee, my idol, you can say. And according to, as per his guidance, I am now standing in front of you. So, the true happiness will come when you treat and cure a very, very bad patients, critical patients. That will give real happiness. And this happiness, whatever you felt, that is also important in life. Entertainment is very, very important. But remember, during the entertainment, you don't cross the limits. Right? যে আমি আর এন্টারটেনমেন্টের মধ্যে ঘুরে যাচ্ছি, মানে আমার এইটা পুরোটা এই জানুয়ারি মাস ফেব্রুয়ারি মাস আমার এন্টারটেনমেন্টের মধ্যেই যাবে। So this is that is a part of life. But during this phase, always try to do your studies at least 2 to 4 hours. That will give you boost. পড়াটা যদি ভালো করে থাকে তাহলে সবই মেন্টাল ঠিকঠাক থাকবে। Otherwise, whenever you will sit in exam, whenever it will in front of any examiner throughout your 5 years, then your confidence will be very low. Your confidence in the stage of your face is very high. I have seen some old students that they are very much confident and performing very well. That means what? That you are all talented. So that talent does not show in front of us. Very unfortunate. Anyway, last class was easiest protein digestions, right? এই যে লাস্ট বেঞ্চ, খুব ঠান্ডা লাগছে তোর, বুঝতে পারছি। Yes. Tell me, what is the end products of protein digestion? What is the end products? But name one products of protein digestion. Hope the 60% of this class attendance will say this answer. কে কে পারবি? দেখি হাত তুলি। তাও though it is very poor, the digestion, after the digestion of protein, কি খেয়ে এসছিস সকালবেলায়? খাসনি? দেখো কাণ্ড। So you will never ever can understand the lecture. Complete your breakfast first, because that needs energy. তোর এনার্জি নেই, তোর ঠান্ডা লাগছে, তোর এনার্জি, তুই কী করে তুই কোপ আপ করবি? কী রে, কেন খাসনি? খাসনি কেন? হ্যাঁ? Why you have not taken your food to breakfast? কেন রে? দেখো, তার কোনো উত্তর নেই। So this is your medical science. You have come for study for last 5 years. ওর কোনো ইচ্ছাই নেই, আমি যেগুলো বলছি শোনার কোনো ইচ্ছাই নেই। কী রে, ডাক্তারি পড়ার ইচ্ছা আছে কি নেই? আছে। যদি থাকে তাহলে তুই একটা ক্লাসে আসছিস উইদাউট এনি ব্রেকফাস্ট, হয়? দেরি হয়ে গেছিল। So after the digestion of protein like eggs, like fish, like veg proteins, like soybeans, this will ultimately form into what? Amino acids. Most of the case amino acids as well as dipeptides and tripeptides. Now my second questions will be that how it is absorbed. বসে পড়। বলেন, ওই যে পাতা উল্টাচ্ছে। You tell me how the amino acids and the dipeptides and tripeptides are absorbed. কোথায় absorb হবে? Where it will be absorbed? After the digestion, you know the some enzymes. Probably is a possibility that 10% of the students you know the enzymes that digest the protein. What are the enzymes? Tell me the some enzymes. Yes? Pepsin. Okay. From where it is released? G cells. chief cells, okay. From the chief cells is released as a pepsin? No. From the chief cell it comes as pepsino কি বলছে pepsinogens. Then what will happen? How it is formed into pepsin? Enterokinase here, stomach. So that is a loopholes of the studying. বুঝতে পারছিস এইখানে তুই যদি কোনো ল্যাকিং করিস কিছু শিখছিস না কিন্তু তোরা it is very bad luck. Remember that after passing from the private medical colleges, if you don't know the knowledge, just society will kick off, বের করে দেবে লাথ মেরে বুঝতে পারছিস even you are MBBS or MD at all এবং I am seeing daily basis what the strength of the knowledge is of your unfortunate, very unfortunate. The treatment will be very will be like layman quacks. So how pepsinogen is converted into pepsin? You don't know. So that is formed by the HCl. So HCl is converting the pepsinogen to pepsin, right? And now the second function of the HCl for the digestion of protein is ke bolte parbe? Very good. So that is a part. That means he listens my lecture very carefully. It is not written in your book, but HCl has two functions is there. Because these lectures will be helpful to write with the knowledge, without any preparation you can go with any topics. If you listen or after listening, completing your class, you at least 20 minutes, you have give some notes, etc. Or you know the video, also recordings are there. That is uploaded in the next day, right? তাই তো তাহলে কখন হয় মানে এক সপ্তাহ পরে হয় সো সেইটা তোরা বলতে পারিস যে আমরা চাইছি যে একটু আগে যদি এডিট করা হয় আমি কিন্তু কোনো এডিট করি না রাইট যাকে গাল দিচ্ছি গালটা এখানে ওপেনলি বলছি কোনো অসুবিধা নেই আমার সো দ্যাট ইজ অলসো রেকর্ডিং সে রেকর্ডিংটা যদি পড়িস তাহলে অ্যাটলিস্ট এই ক্লাসে এইগুলো হয় না ইউ আর সেইং দ্য এন্টেরোকাইনেজ হোয়াট ইজ দ্য ফাংশন অফ এন্টেরোকাইনেজ সিট ডাউন ইউ তো তোর পাশে টেল মি আমি তো টেরা নই রে বাবা স্কুইন নই মনে হচ্ছে স্কুইনটা আমি হ্যাঁ বলো হোয়াট ইজ দ্য ফাংশন অফ এন্টেরোকাইনেজ ভেরি গুড দেন so what is the importance of so much enzymes? That is trypsin was enough to break the peptide bonds. So why it is chymotrypsinogen, chymotrypsin, then pro-carboxypeptidase, this is carboxypeptidase, then pro-elastase to elastase. Why so much enzymes are required? Any idea about this? কে বলতে পারবে? Why so much enzymes are required? বলো। Kinds of bond? No, there is the same kind of bond. No, not like that. No, there is no. You don't know about the structure of the amino acid. Yes? এখনো আসেনি বলো কে বলতে পারো বলো nearby amino acid, right? That acts on the different types of এই একটা বন্ড আছে এইখানেতে মনে কর আর্জিনিন আছে আর এখানে একটা বন্ড আছে হ্যাঁ আবার এখানে একটা মনে কর ট্রিপ্টোফেন আছে এখানে একটা বন্ড আছে অ্যান্ড দেন এখানে মনে কর একটা লাইসিন আছে সো লাইক ট্রিপসিন ইটস অ্যাক্টস অন দ্য মেনলি arginine and nearby arginine near peptide bond near the arginine and lysine তাহলে ও এখানে কাটবে আবার এইখানে কাটবে বাট এই ট্রিপ্টোনের কাছে যে বন্ড সে কি করবে কাইমোট্রিপসিন অ্যাক্টস অন দ্য ট্রিপ্টো যদি আমি ভুলেও যাই অ্যামিনো অ্যাসিড বাট দিস ওয়ার্ডস ইজ ভেরি ইম্পর্টেন্ট যে হোয়াই সো মাচ এনজাইমস আর রিকোয়ার্ড ফর দ্য প্রোটিন সিনথেসিস সিট ডাউন all sit down now the digestion So the digestion is process was there, that is the end products was after the digestion, that is amino acid, dipeptides and tripeptides. How it is absorbed? How it is absorbed? I am drawing this. This is very important for exam. This is your cells, right? Right? Then tell me how it is absorbed. What's import? কোথায়? It is your apical site and this is your basal site. Apical, okay, apical site. This import is called, what's import? Sodium amino acid. Now question is why sodium is coming? Sodium is enough. In the women there is enough. Now sodium is coming along with the amino acid is coming. Okay, fine, accepted. Now question is why sodium is coming? Because sodium comes only there is a electrochemical gradient will be formed. So how it is gradient is formed? Yes, where it is present? Basal region. So this is the basal region. And this one is accepted that this is one the fat deck. This it enters E, potassium. So sodium is out. So that's why it is chemical gradient will form. Electrochemical gradient will form. Now sodium is coming in. Is this enough to complete the gradient? No. Then yes. So that in so that is not enough. So now what is the need of H plus? Now what will do this H plus? What will do? Do you think the acidic medium is very helpful for this? Not at all. So that should be enter the cell. How it will enter? Yes. So that is another simple. That is come as a this way. That is a H plus also, right? So now from the lumen it has come into the cell. What is cell? It's called enterocyte. So this is your amino acid. This is your also there, no problem at all in this. Now dipeptide is there. We don't want to send this into the liver circulation. So that should be breakdown by peptides enter into the cell, right? So that is ultimately from the amino acid and amino acid is released and then into the blood vessels, then it goes to the liver, right? তাই তো? Now লিভারে যদি চলে গেল তারপরে কি তৈরি করে? What will form? Liver, what is a amino acid goes into the liver, right? So that forms the ultimately again proteins, different proteins. Name some proteins from your liver. Tell me. Name some proteins. Blood পড়ানো হচ্ছে তো, fibrinogen, clotting factors, clotting these proteins, right? So these proteins are formed from your liver. What is the function of liver? কে বলতে পারবে? চার পাঁচখানা বল, চার পাঁচখানা বল, ফাংশন বল লিভারের। নাম্বার 1, দেন ওকে হলো, বাইল দিয়ে হয়ে গেল, বাইল 2, দেন bile synthesis. Only you can say bile synthesis. You can say the conjugation, right? No problem. Why conjugation happens here? Starcobilin urobilin ওখানে যাবে, লিভারে যাবে. Why your color of the urine and stool is like that? That is for that. That is a changes happens due to the bacterial into the starcobilinogens to starcobilin, urobilinogen to urobilin for the urine, right? So not for that. Liver কি হবে? কেন conjugation হয়? Due to presence of some enzymes. What is the enzymes? Uridyl glucuryl transferase. এই তো biochemistry জিনিস, চল ছাড়। So that is a conjugation. Then আর কি functions বলো, আস্তে আস্তে বল, বুঝতে পারছি না। that means metabolism. You can say only one word. That is a metabolism. Then bile হয়ে গেছে, বাইলের গল্প শেষ। Then হয়ে গেছে, দেন কি পড়েছেন? কি বলছে? Heat. What do you mean by heat? Any metabolism give us heat. Then others? No, that is not the storage of this. This is storage function is there. That is storage function of blood. It can cause the storage of blood. Why? Why? Jana ache? Why? Why the storage function of liver is very high? That is around half liter of blood is stored in the liver. How and why? Bolo. Basic things. These are very important. Eta ki ekta heart, right? Then এই হার্ট থেকে কি আসবে? এখান থেকে আমাদের ডিসেন্ডিং অ্যাওর্টা, তাই তো? দেন এখানে তিনটে ভাগে ভাগ হয়। এই ডিসেন্ডিং অ্যাওর্টাটা কিভাবে ভাগ হয় রে জানিস অ্যানাটমিতে? হ্যাঁ, অ্যাবডোমেন পড়ানো হয়েছে? হ্যাঁ, সিলিয়াক ট্রাঙ্ক, সুপিরিয়র মেসেন্ট্রিক অ্যান্ড ইনফিরিয়র মেসেন্ট্রিক। ছেড়ে দাও। যে সিলিয়াক ট্রাঙ্ক যেটা থাকে, দ্যাট গিভস অ্যারাউন্ড অ্যানাদার ব্রাঞ্চ, রাইট? এখানেতে কতগুলো অর্গ্যান আমি এখানে এঁকে দিচ্ছি, কতগুলো অর্গ্যান এঁকে দিচ্ছি, রাইট? এইটা হচ্ছে লিভার, রাইট? এই লিভারে এর সাপ্লাই আছে অ্যারাউন্ড প্রায় 400 ml, ঠিক আছে? পার মিনিটে যাচ্ছে, পার মিনিটে। নাও দ্য কোশ্চেন ইজ দ্যাট এই যে অর্গ্যানগুলো আঁকলাম, এদের এখান থেকে সাপ্লাই আছে বিভিন্ন। আই এম নট গোয়িং ডিটেলস, বাট আফটার দ্য ফরমেশন দেন দে উইল কি, এখান থেকে ভেনাস আসবে, ভেনাস, এগুলো ভেন, এটা হচ্ছে আর্টারি, অ্যান্ড দিস ইজ উইল বি ভেন, রাইট? অ্যান্ড আলটিমেটলি ফরমেশন কি হবে? এটার নাম কি বল? পোর্টাল ভেন। তাহলে যা কিছু আমার ডাইজেশন হচ্ছে, কেন বলছি যে আমরা ফ্যাট ছাড়া, only the fat that first go to the lymphatic system, that is lacteals. Sit down all. Lacteals. But in this fashion, the liver receives the dual blood. একদিকে এখান থেকে ব্লাড পাচ্ছে আর্টারিয়াল ব্লাড, আবার এইখান থেকে পাচ্ছে পোর্টাল ভেনাস ব্লাড। এবং পোর্টাল ভেনাসের ব্লাডের কত অ্যামাউন্ট? এনিথিং আইডিয়া? দ্যাট ইজ 15002 2 লিটার। হ্যাঁ, এটা 2 লিটার, এটা 1.5 লিটার পার মিনিট। তাহলে এটা পাচ্ছে প্লাস এটা পাচ্ছে। নাও দে উইল গো আপ। এগুলো কি না হেপাটিক ভেন, আলটিমেটলি জয়েন করে কি হবে না ইনফিরিয়র ভেনা কেবা, দ্যাট উইল ড্রেন ইন্টু রাইট হার্ট, তাই তো? এই হচ্ছে জিনিস, আর এটাই হচ্ছে যে কনসেপ্ট, এবং এটাই তোকে হেল্প করবে হোয়েন এভার ইউ আর ইন কার্ডিওলজি, হোয়েন এভার ইউ আর right? So it is heart and the branches are there, and first branch is the celiac trunk or celiac, you can say artery, that will gives the to the liver. The difference, the liver, that is you can say the spleen, pancreas, small intestine, large intestine, all organs are there. After the digestion, all the things enter into the portal vein. তাহলে পোর্টাল ভেনে আসছে, কিন্তু আলটিমেটলি এটা ড্রেন কোথায় হচ্ছে? into the liver. So liver gets a huge amount of blood, and at least half liter blood is storage. The storage is a function of your liver, and then after it is your hepatic veins connected to the inferior vena cava, and that connected to your right side of heart. It is the right side of heart. Now you know already that in some cardiological cases the right sided congested failure, জানা আছে, right sided heart failure. That means it's not pumping at all. What will happen? That will happen that will not pumping at all. পাম্প করলে কি করছিল না, সে পালমোনারি টাং দিয়ে ব্লাডটাকে আউট করছিল, দ্যাট ইজ এ পাম্পড আউট টু দ্য পালমোনারি টাং and give to the pulmonary your system, but that's not pumping, that's a failed right heart failure. Now during the right heart failure, liver is enlarged. Whenever we see any patient is in failure, in heart failure, we always check, palpate the liver. Liverটা কত বড় হলো? Why? Because if it is failed, this blood is black flow, that is black flow, that will black flow, right? পাচ্ছি বোঝাতে? black flow হবে. If it is flow back, then lots of blood will accumulate in the liver, and that's why liver enlargement happens in case of your right sided congestive cardiac failure. নামটা হচ্ছে right sided congestive heart failure, congestion means what? Blood. So এইভাবে জিনিসটা হয়। এইভাবে similarity, the cirrhosis of liver, ascites, everything happens. So you remember that if this, you know the general physiology also, if this is coming, normal portal venous যে pressure সেটা হচ্ছে only 9 millimeter of Hg, right? If it is happens that failure happens or liver is damaged, and then this portal hypertension happens. That means around 15, 16, 17, 18, 20 millimeter of Hg happens, is portal hypertension. Now if a blood vessels having some hypertension, and then the fluid will go out, you know the hydrostatic pressure, right? So fluid will go out, and that is caused the ascites or peritoneal fluid. এইভাবে জিনিসপত্রগুলো পড়তে হবে। এইভাবে যদি পড়তে পারিস তাহলেই তোকে মুখস্থ করতে হবে না, নইলে মেডিসিনটা মনে হবে যেন পুরো মুখস্থ করতে হবে, আর মেডিসিন মুখস্থ করলে পেশেন্টের সামনে তুই অ্যাপ্লাই করতে পারবি না, right? So that is your physiological basis of medicines. Physiology না বুঝলে মেডিসিন কিচ্ছু বুঝতে পারবি না। যে কোনো তুই যত কনসালটেন্টস আছে জিজ্ঞেস কর, এবং বিলিভ মি, ইন দ্য ফরেন, আই ওয়াজ ইন দ্য 2 years in the England, তো any type of pathology they see from the physiology specialist, clinical physiology, কেন পা ফুলছে, কেন মুখ ফুলছে, কেন হোল বডি ফুলছে। So that is important part. Whenever you understand in this way, that is, the liver has some function of getting dual blood supply, but this pressure is increased, that causing the portal hypertension and exudation of the fluid in the interstitial space, that is your peritoneal space, that causing your ascites. তাহলে এই যে cirrhosis of liver damage, তাতে কেন আমার ascites হবে, পেট ফুলে জলের মতো হয়ে গেছে। এই পেশেন্টগুলো যখনই দেখবি তখনই যেন মনে পড়ে যে এই জিনিসটা এই জন্য এটা হচ্ছে, and that patient may present as a congestive cardiac failure also, right? Cardiac failure right side হওয়ার পরে ultimately left side failure হয়। Not only that, if right side failure happens, that in lung pulmonary system also congested, right? So in these cases it is called cor pulmonale. এগুলো পড়ানো হয়েছে? কার্ডিওভাস্কুলার সিস্টেম শেষ হয়েছে কি আদৌ? শেষ হয়নি। কে পড়াচ্ছে? স্যার তো চলে গেছে শুনলাম। So that is very much unfortunate for you and also us. Anyway, so this is your 400 to 300, 400 ml per minute is coming from the artery, and 1.5 liter to 2 liter is coming from, in this fashion is coming as a liver. So liver has some storage function of the blood, not like that it stores only the glycogen, etc., energy, right? So in these fashions you have to understand the liver, how it is liver helpful. And another 2 important functions are there, the detoxifications, filtration of the liver. How it will come, I will discuss if time permits today or in the another class, how the filtration, and very much important that you seeing that all the digestion, all the digestive product or absorptive products is coming into ultimately portal hypertension. Not only that, whatever infection of these organs, that infective bacteria, virus, fungus, etc., that enter ultimately where? It comes into the portal vein, ultimately in the liver. So liver has some protective phenomena or filtration phenomena that helps to reduce the bacterial load, so that যদি আমার এখানে ব্যাকটেরিয়া কিছু আসেও, যদি এ কিছু করতে না পারে, আলটিমেটলি এ কিন্তু হার্টে পৌঁছাবে, লাঙে পৌঁছাবে, সিস্টেমিক সার্কুলেশনে যাবে। So systemic circulation means sepsis may happen, but it does not happen this. In our day-to-day practice, all the time we are taking the bacteria through water, through food, etc. But all the time we can't sick because of our immunity, number 1, and number 2 is your liver. In the liver there is a macrophage. What is those? Kupffer cells, right? That is Kupffer cells. Why it is present? Its Kupffer cell helps to detect the bacteria and then damage to some extent. So less than 1% of bacteria can be passed through your heart, less than 1%, and our body immunity is enough capable to handle that amount of bacteria or infectious agent. If it is more than 50%, 60%, তাহলে আমাদের ইমিউন সিস্টেম নিউট্রোফিল একে করতে পারতো না। ইন দ্যাট কেস লাইক আমার নিউমোনিয়া এটসেট্রা যখন আমাদের হয় তখন সেটা পারে না, তার সেটা কি পারে, তখন আমাদের সেটা শো করে যে না, ড্যামেজ অলরেডি হ্যাপেন্স। So in this way liver has enormous function is there, and the last or the next is the regeneration power is there. যদি লিভার আমি অর্ধেকটা কেটে দিই তাহলে দ্যাট ক্যান রিজেনারেট, right? That is also a function of your liver. So storage function, metabolism function, protein synthesis function that was started for this. The protein is amino acid is there going after the absorption, and then protein synthesis happens. Filtration, detoxification. Detoxification means what? Pre-cytochrome 450. Chilo to egulo. So genobiotics, right? So lots of toxins can be destroying in the liver. That is your genobiotics. It's not my domain. It's also helpful. And also regeneration, it's also helpful. Filtration. Filtration means what? Bacterial filtrations. I mean that by the Kupffer cells. That is very much important. That is a liver has some function. And you know that liver and gallbladder is our accessory your GI system, right? Alimentary canal, number one. In the first class I have described, and liver, pancreas and gallbladder is our accessory organs for our GI system. That is also important, you know that. In the liver section, you will learn that in case of your histopathology, etc., you can learn. But still, if I started this, I want to something that is it is suppose it is your liver, right? Now in the liver, you already probably you know that some hexagonal structures are there. What are those? What are those? It's called এরকম পুরো রিভার জুড়ে থাকে, পুরো রিভার জুড়ে। আমি যদি এটাকে এরকমভাবে একটা এঁকে নিই তাহলে জিনিসটা থাকবে এরকম। হ্যাঁ, এটা এগুলোকে কি বলে জানা আছে? কি বলে এগুলো? এগুলোকে বলা হয় হেপাটিক নোডুলস। সো হেপাটিক নোডুলস দিয়ে হেপাটিক স্ট্রাকচারটা তৈরি হয়েছে, right? So each and every parts of the liver there is a lobule, and then there is a central vein, right? You know that, you know the central vein is there, and also some sinusoids are there, you know already. There is a sinusoids are there like that, like this, like this, like this, like this, like this. In this fashion, you know the sinusoids are there, sinusoids are there, right? These are your sinusoids. Now question is that এগুলো করাবার মানেটা কি? এগুলো করার মানে হচ্ছে you know already that what do you mean by portal tired? Any idea about that portal tired? Portal vein, bile duct, hepatic artery. বোঝা যাচ্ছে? So these are your signs. আমি যেটা জন্য বক্তব্য রাখার জন্য এটা বললাম যে this in the hepatocytes তাহলে কোথায় আছে? Hepatocytes means liver cells. The liver cells are in between these sinusoids. এইগুলোতে আমার hepatocytes, এইগুলোতে hepatocytes, এইগুলোতে hepatocytes. The hepatocytes are there in between these sinusoids, right? Not only that, these are your endothelium, epithelial layers, and in between these layers we have our Kupffer cells. এইগুলোতে আমার Kupffer cells থাকে, এইগুলোতে এইখানেতে। তো Kupffer cells এর ফাংশন কি? একটু আগে বললাম, that detects the bacterial that is coming through from our portal vein from different organs, and then is damages because Kupffer cells is our as a macrophages. Macrophages are lots of macrophages are there in our body. In our brain that is called brain এর তাকে কি বলে? Microglia. লাঙে কি বলে? Alveolar macrophage. হ্যাঁ, কিডনিতে বলে juxtaglomerular cells. তাহলে these are organs. লিভারে কি বলে? Kupffer cells. বোনে কি বলে? Osteoclast. বোঝা যাচ্ছে? So these acts as a macrophages. So lots of macrophages are there, and macrophages are basically nothing but a modified monocytes. Monocytes থেকেই macrophage হয়, right? Probably you have learned from the blood. So hepatic nodules are there, sinusoids are there, sinusoidal epithelium, endothelium are there. In between these Kupffer cells are present, and then this is central vein is there, right? এইখানেতে থাকে আমাদের portal vein, একটা hepatic artery and bile duct. এই hepatocytes এর মধ্যে থাকবে bile duct. Because why? Because hepatocytes forms the এখনই বলছিলি bile synthesis করে, তাই তো? That forms the ওইখানে, and then bile canalicular system will come, and then ultimately it come into the common hepatic duct, then cystic duct, then your common bile duct, then enter into pancreatic duct, ampulla of Vater, Think about that. Then ultimately second part of duodenum after the relaxation of the sphincter of OD, and sphincter of OD relaxation held by the hormone CCK. Yes. So CCK has some functions, that is contraction of gallbladder as well as it relaxes the sphincter of OD so that bile can enter, and bile is essential for our fat digestions, micelle formations and also emulsifications. That is essential. And rest of the bile, that is the bile salts, goes enterohepatic circulations 95%, and then again into come into river. Entero means intestine, especially small intestine. Okay, so I am finishing this part. There is a related part was there, so I entered into this so that you can understand what is digestion goes on. Any digestion of this state, small intestine, large intestine, what will go into enter into the portal vein, and that portal vein ultimately. So এটা বোঝা যাচ্ছে এরা কিন্তু ডুয়েল সার্কুলেশন থাকলেও তাদের কিন্তু এখান থেকে তারা পাচ্ছে না, এরা দিচ্ছে, they are giving, but liver is not giving, is taking the your portal blood, they is are taking. তাহলে এইখানেতে এই চিহ্নগুলো এই দিকে হবে, বাট এরা কি করছে এখানে দিচ্ছে. They are only the one circulation is coming from the artery, and this portal vein and hepatic artery is both are coming into the blood. So that is the storage capacity of the blood. Okay, now, so this you know the enterocyte, how it is absorbed. This is very easy and very meticulously scientific, and if you understand the science, then you can't memorize করা দরকার হবে না। আর যদি কিছু বুঝতে না পারিস তাহলে মেমোরি করতে হবে, মেমোরি করতে গেলে পরীক্ষা হলে ভুলবি, কারণ দ্যাটস ওয়াই ইউ হ্যাভ থ্রি সাবজেক্টস আর দেয়ার, বায়োকেমিস্ট্রি, অ্যানাটমি এটসেট্রা। সো মেমোরাইজের কোনো জায়গায় নেই অ্যাজ পার ফিজিওলজি, কোনো জায়গায় নেই। মেমোরাইজ করা দরকার হবে যদি কোনো ডাটা থাকে, ডাটা ইজ এসেন্সিয়াল 30%, 40%, এটসেট্রা। সো নাও উই নো অলরেডি এনাফ অ্যাবাউট আওয়ার স্মল ইন্টেস্টাইন, ডাইজেশন এটসেট্রা। নাও হোয়াট অ্যাবাউট দ্য ইয়োর লার্জ ইন্টেস্টাইন, হোয়াট ইজ দ্য রোল? এর কি কোনো দরকার আছে? দরকার না নেই? কি আছে, কি কাজ আছে শুনি লার্জ ইন্টেস্টাইনের, শুনি। হ্যাঁ হ্যাঁ বল, কি বুঝতে পারছি না। ফরমেশন অফ ফাইবার তো খেলাম, সেলুলোজ তো খেয়েছি, আগে বলেছি না, সেলুলোজ তো একটা ফাইবার। দেন ফাইবার খেয়ে আমার লার্জ ইন্টেস্টাইনের কি কাজ আছে? লার্জ ইন্টেস্টাইন কেটে বাদ দিয়ে দিলে কি অসুবিধা হবে? মাইনর অ্যাকশন, মোস্ট অফ দ্য ইম্পর্টেন্ট ফাংশন অফ লার্জ ইন্টেস্টাইন হোয়াট? Water absorption, very good. So that is a three functions are there, that is water absorption, electrolyte absorption, sodium chloride etc. And then sit down, then another function is formation of ওই যেটা বলছিল সেটা হচ্ছে vitamin B complexes by the help of bacteria. Lots of normal flora is there, bacteria is there, that creates our microbiome. So that I already in the GI system I have taken one class for the microbiome. All the disease, maximum disease, depression, anxiety etc., neurological problem, asthma, stroke, cancers, it's nowadays is very much interconnected with the lack of microbiome. All of us, if you taking the junk food etc., baje khabar, not organic food, we are all daily we are killing our microbiomes. Microbiomes are helpful to create an ecosystem in our environment, and all are related to our chronic diseases. So depression, anxiety, Alzheimer's disease, neurodegenerative diseases are now very much connected, very much essential. And I also already I have started my treatment in case of asthma to giving some the probiotics for the long term. It's very helpful. It is written in very good journals that some costly probiotics are there in case of some chronic diseases like chronic asthma, in case of childhood asthma, right? That is also helpful. That means what? That means our internal every disease starts from your GI system. That is এরকম করে rectum and then anus. এরকম কেন করলাম? This is a sharp angulation is there. This is important. Sharp angulations, that is a recto-sigmoid junction. Is a sharp angulation is there. মানে এরকম এসে এরকম করে নেমে আসছে না, এরকম করে এসে এরকম নামছে, এরকম করে নামছে নি এরকম করছে, then come. So this angle is very important. Now এরকম কি থাকে ওরা? এরকম তো থাকতে পারে না। এটা কি না, এটা শিকাম, রাইট? আর এখানে আমাদের ইলিওসিক্যাল জাংশনটা, রাইট? অ্যাপেন্ডিক্স আমাদের কোন দিকে থাকে? এদিকেই থাকবে, এই দিকের দিকে এরকম করে থাকে অ্যাপেন্ডিক্স। অ্যাপেন্ডিক্স ইজ আ ভেস্টিজিয়াল আর্ট, বাট appendicitis is very much common nowadays in children. Last 3 days back I have came across acute appendicitis. The presentation only was diarrhea. Only presentation was diarrhea. right? A little bit vomiting was there. So how can we exclude that? That may the acute appendicitis. So the criteria is that any abdominal symptoms or any GI symptoms like vomiting, diarrhea, etc., you have to examine all the four quadrants of your abdomen. Whenever I search in the right iliac fossa, then extensive tenderness you feel, right? So I suspect CT scan, acute appendicitis, OT, done. Okay, so if you only see only the diarrhea is there and you giving the ORS etc., that patient may die. So at least হাত দিতে হবে আর হাত দিলে জানতে হবে যে কি কোন জায়গাগুলো দেখব, right? So if it is palpate, I am seeing the appendix was like that. So that can be a burst anytime. So that is your appendix, and appendix can be cut off and no role at all basically. We all of us, it's the vestigial organs, you know. So there is the ileocecal junctions are there, and now if food has digested, now some undigested food has come. Undigested food will come into this way, that is your gastroileal reflex, right? Gastroileal reflex helps so that the food enter into food na, digested food, you can say fecal remnants, you can say the remnants of food or undigested food are there, but not structure like that. এরকম structure থাকে না, কিরকম structure থাকে বইতে, কিরকম থাকে, এরকম 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 থাকে না, হ্যাঁ? That is what is called is, এরকম তো থাকে, তাই তো, এরকম থাকে তো. So this is your food, undigested food is there. Now there are two types of movements in the large intestine. You know already the total peristaltic movement, that is segmentations. আর কি বলেছিলাম? Propulsive movement, segmentation movement, and reservoir, three, right? These are all happens in the small intestine and the stomach. There is no movement, and also esophagus also it helps for the propulsion. In case of large intestine, there are two types of contraction, or you can see the movements of large intestine happens. What are those? One is very important, that is a Haustral contraction. That is called Haustral contraction, HAUS. Number two, another important part, that is your mass movement or mass peristalsis. Mass movement or mass peristalsis, right? So what is the importance of it? Without these two, that undigested food or fecal material you cannot be evacuated, or you can free your bowel, right? This is very, very important. Now the clinical scenario is that some of your patient can feel after suppose a 55 years female, in my family there is a history, 55 years of female having 3 childbirth, history of 3 childbirth, he incontinence for 3 years. That সে কিছু বুঝতে পারে না, তার ইনকন্টিনেন্স হয়ে যায়, সে বাইরে যায়, সোশ্যালি অ্যাকসেপ্টেবল নয়, তো দ্যাটস কি ইউজ করছে না, ন্যাপি ইউজ করছে, যারা বাচ্চারা ইউজ করে. সো হোয়াট ইজ হ্যাপেনিং হোয়ার, সি ইজ নট টেলিং ইট ডক্টর. So that thing is happens because of that the childbirth, the anal canals and the muscles of anal canals to some extent tear happens. So that means what? For the defecations, the anal structure, muscles, nerve should be intact. So otherwise কি মনে কর সাপোজ তোদের মধ্যে কারো এখানে কারো আমাদের সবারই আমাদের মনে হচ্ছে একটু পটি গেলে ভালো হয়, মনে হচ্ছে হয়, ইটস ভেরি কমন. Because of the পটি গেলে মনে হয়, that helps your mass movements. It happens only 3 to 5 times per day. It only happens 3 to 5 times per day. Now whenever this you will not poop, because the availability is not there. It is not the appropriate place to poop, right? So these two contraction helps. How it is helps? I am saying Haustral contraction. You know the Haustral কোত্থেকে এসছে না, হস্ট্রা থেকে. Haustra means what? এইগুলোকে বলা হয় Haustral. কেন হচ্ছে? You know already in anatomy and in 11-12 class, that is a band like structure is there, that is called tinea coli. নাম মনে আছে? TEANIAE coli. These are your bond. Tinea means what? Tinea in Latin, it is called basically ribbon. ফিতে. So that is called ribbon. এই জায়গাগুলোতে that is the tinea coli are there. Tinea coli are there, and tinea coli is up to the rectosigmoid junction. This is not your anatomy class, I am sorry, but still it is important to understand what is happening and how it is Haustral contraction happens. Haustral contraction happens in two ways. Number one is whenever this is accumulated food, undigested food is there, you know already in the previous that anything in accumulation is causing the stretching. That means stretch receptors are stimulated, and so the short arc reflex by the myenteric plexus happens. So the contraction will happen. Throughout any of your intestine, you have lots of million myenteric plexus in your which layer? Which layer? Muscular is external, right? So that is the muscle layer. That is your local stretch reflex is there, myenteric reflexes is there, so that is contraction happen. But most importantly, this tinea coli is basically what? It is a longitudinal smooth muscles. আর কিছুই না, এরা কিন্তু smooth muscle. They are longitudinal smooth muscle. Right? These are longitudinal smooth muscles are there, that is contraction happens, and so that they what? এইগুলোকে বলা হয় Haustral. Right? So that is called Haustral contraction. Ultimately কি করা হচ্ছে? এইগুলো থেকে কি করা উদ্দেশ্যটা কি? Haustral contraction এর aim কি? Mass movement এর উদ্দেশ্য হচ্ছে aim is that to move the fecal matter into the rectum. Right? But what is the role of Haustral contraction? Haustral contraction role is that to contact, but to increase the contact between the fecal matter or some undigested food with the mucus, so that absorption of water, electrolytes, vitamin B complex happens. বুঝা গেল? So that is your Haustral contraction that helps to remain contact with the mucous membrane of your ascending colon and ultimately transverse colon. Remember that the Haustral contraction, to some of the books says that this ascending and here it is Haustral contraction happens, but I think it will be Haustral contraction and one part it is transverse colon and the descending colon, sigmoid colon, etc. is your mass movement. বোঝা গেল? That is will be better. So this movement it will come, it will go up in this way. ঠিক আছে, fecal matter going on, and also it increases the contact time because of stretching, and so distension happens. Distension happens বলে myenteric plexus is short arc reflex is happening, no long arc reflex, and also the tinea coli is contraction is happening, contraction, and so the Haustral formation, and so it is again it is using for more contact time with this mucous membrane, and so that water absorption, then electrolytes absorption, some parts of vitamin B complex absorption happens. So that's why so much important is this. So large intestine is very important. We are taking food, you can't say that আমি জল খেয়ে নিলাম স্টমাকে আমার জলটা অ্যাবজর্ব হয়ে গেল, দারুণ ব্যাপার। No, not at all. হয় না। The water goes from the stomach, then this way to some extent can absorb, but most of the 95% is absorbed from your large intestine, and by this way, by the help of Haustral contraction, by the help of tinea coli. Tinea means what? Ribbon like band. So that is called, it is tinea coli. This is not a bacteria at all. It is a longitudinal smooth muscles banding over the ascending colon up to the rectosigmoid junction. তারপর আর নেই, right? So rectum কিন্তু কোনো tinea coli থাকে না। কেন? কারণ they are merged to the proper longitudinal smooth muscle. Proper longitudinal, they are not forming any band. So there is no contraction. Haustral contraction does not happen in the descending colon, right? It happens into the, either you can say transverse colon or 2/3 of the transverse colon you can say. You know that here it is a hepatic flexor and here it is a splenic flexor, you know already, probably abdominal. It is not your anatomy class, I'm sorry. So this is your helpful for the Haustral contraction, and also the second is mass movement, and this is your mass peristalsis, and followed by defecation reflex, followed by defecation reflex. That is for your exam, right? Defecation reflex is repeatedly is asked in viva, oral, theory, etc. So that is why we can put our stool into this. So now come to the defecation reflex, right? So defecation is basically এইখানে আসতে হবে। Defecation reflex starts basically in the rectal junctions, that is from the rectum, right? So in this fashion, you can say that after the Haustral contraction of the mass peristalsis, মাস পেরিস্টালসিস কি করবে? মাস পেরিস্টালসিস কিচ্ছু না, মাস পেরিস্টালসিস এখান থেকে সেই স্টুলগুলোকে টেনে টেনে নিয়ে এসে দ্যাট উইল অ্যাকুমুলেটেড ইন হেয়ার, রাইট? নাও আই এম সেপারেটলি ড্রয়িং the structure of your rectum. Suppose this is your sigmoid and this your rectum, right? This is rectum and this is your internal anal sphincter. This is your internal anal sphincter and this is your external anal sphincter. External anal sphincter is there and then only you can pass. তো এটাকে যদি পাস করতে হয়, suppose there is lots of fecal matter enters into here after the mass peristalsis. Right? Now again stretching effect is there. Stretch receptors will be activated and you know that in the layers there is a myenteric plexus are there. Lots of myenteric plexus, millions of myenteric plexus are there. So that will send the sensory nerves. That will send the sensory nerves. কোথায় যাবে sensory nerve? Ultimately spinal cord. Spinal cord কোথায়? S2, S3 and S4, right? In this fashion, this will go, right? কোথায় গেল? Spinal cord. Which level? Sacral level. কোন sacral level? That is S2, 3, 4. And this happens that after the sensory nerve, it acts into the spinal cord. এখন তোদের CNS পড়ানো হয়নি বলে আমি বলতে পারছি না, posterior horn দিয়ে যাবে and then it will stimulate and that will come. এখান থেকে কি আসবে? এখান থেকে আসবে আমাদের parasympathetic nerves. প্যারাসিম্প্যাথেটিক নার্ভ, তারা কোথায় দেবে? এখানে সাপ্লাই দেবে, এখানে সাপ্লাই দেবে। ইভেন ইট উইল গো ইনটু দ্য ইন্টারনাল অ্যানাল স্ফিংক্টার। রিমেম্বার, internal anal sphincter is autonomic supply due to this is a smooth muscle. Due to smooth muscle, yes, smooth muscle, circular smooth muscle, right? And the outside, that is the external, that is voluntary, that is skeletal muscle. তাহলে এই যে যেটা বললাম একটু আগে, যে আমার যেখানে সেখানে আমি পটি করিতে পারি না, আমার যখন ইচ্ছা হবে কনসাস ভলেন্টারিলি, দেন অনলি উই ক্যান evacuate our bile. That is the help of your external, because it is supplied by your somatic nerve. There is my control, that is your control, but this is not your control. Whenever it is lots of stool is come due to the mass peristalsis, you will feel, you will urge that we may have to defecate very quickly, and this is your parasympathetic nerve. And this is your, we term say there is a pelvic nerve also, that is your splanchnic nerve, you can say. That is your pelvic nerve or parasympathetic tone is there. So parasympathetic supplies the rectum as well as sigmoid as well as internal sphincter, but not supplied this. তাহলে এর সাপ্লাই কি করে হয়? That is supplied by pudendal nerve. That is a somatic nerve, pudendal nerve. You know, probably you don't know the name, but this is your pudendal nerve. কোথায় যাবে এটা? এটার সঙ্গে কার কানেকশন আছে? cerebral cortex. কেন cerebral cortex? Because consciousness helps your brain, right? এইখানে আমার ব্রেনের কর্টেক্স, এইখান থেকে আমি যখন ভাববো যে হ্যাঁ this is your my appropriate, then they will send in the spinal cord, yes, it is the appropriate place, and then these fibers will come to contract for the relaxation of this one. So then only the contraction of the rectum, relaxation of the both inner internal anal sphincter and external anal sphincter, which ultimately তাহলে পটি বাইরে বেরোলো, বোঝা গেল? Then only it will come. So whatever your day-to-day life, this is important, very very important, because you can came as a history that sir আমার পটি হয় না, that means constipation, and পটি স্যার হয়ে যাচ্ছে, that is also incontinence, that is called incontinence. This is in the next class I will try to describe to some extent. So remember that Haustral contraction, mass movement or mass peristalsis, then your defecation reflex, right? Normally the sympathetic stimulation happens here. In case of your internal sphincter and rectum e sympathetic stimulation থাকে, তাতে কি থাকে? L1 and L2 থেকে আসে, এরা হচ্ছে sympathetic stimulation. এরা কি করে? that is relaxes the rectum, এই এখন আমার তোর যেমন আছে, and then it is also internal, this part, this is internal anal sphincter will be contracted position, right? So relaxation of rectum and contraction of the internal sphincter, how stool will pass? No, never will pass. Only it will can urge when the mass peristalsis helps to too much accumulation of the stool inside your rectum. Rectal will your stretching, and your distension happens, and then the sensory nerves will go into the spinal cord. From the spinal cord, since a parasympathetic nerve will come, and then come মানে কি এখানে করে কি করবে ও এখানে করে এটা করবে সেটা হচ্ছে contraction. Contraction means what? That is contraction happens rectum. Rectum যদি contraction করে, that means এটা relax করছিল, contraction করবে, and also the relaxation of the internal anal sphincter. এই পর্যন্ত তো গেল, এই পর্যন্ত চলে আসবে, but whenever you consciousness that this is not appropriate place to defecate, then only you can voluntarily tighten the external sphincter. হয়তো নাকি হ্যাঁ কোথাও গেছিস বা হেঁটে হেঁটে আসছিস, নিয়ে পটি পেয়ে গেছে, দৌড়াচ্ছিস, তা কি করতে করতে যাচ্ছিস? নো, নট অ্যাট অল। তাহলে কি করছিস যেটা সেটা হচ্ছে পুডেন্টাল নার্ভ দিয়ে এইখান থেকে সেন্সারি আসছে, ওরে ভাই তুই থামা থামা থামা। সো দ্যাট ইজ ইউর কন্ট্রাকশন, but whenever it is defecated, properly places conscious center of your cerebral cortex will give signal for the relaxation of your external anal sphincter. বোঝা গেল? External anal sphincter is your skeletal structure supplied by the pudendal nerve, and internal is a autonomic supply, that is parasympathetic nerve, that is not voluntary, it is involuntary. এটা আমাদের beyond our control, but this is our control, right? Thank you.